Hello, everybody. Good morning, good afternoon, or good evening, depending on where you are. I want to welcome all of you for this webinar, which is the first in the year 2024, Mental Health for All webinar, and we have a good topic and a good lineup of speakers. So stay tuned in, and hopefully you will enjoy 60 minutes of talking about mental health for all. The topic for the webinar today is mental health education for future doctors and nurses, which I believe you will fully agree that it's a very important topic. My name is Shekhar Saxena. I am professor for the practice of global mental health at Harvard Chinese School of Public Health. And I also work very closely with United for Global Mental Health. And I have the pleasure of beginning and moderating this webinar. I would request all participants, all attendees, to kindly introduce themselves in the chat by name, your organization, and your country, or wherever you are joining from, and uh, and take active part in the discussion through the chat, but also ask questions in the question and answer section of the Zoom, and we will pick up some of the questions, hopefully at least some of the important ones in the end, and ask the panelists to give their response to the questions. I would also ask the panelists to introduce themselves, but before I do that, I would ask Antonis, who has joined the United for Global Mental Health recently, but he will have the responsibility for the Action Network as well as some other activities to introduce himself. And that will be nice because he's a member of the United, and United is the agency that organizes these webinars. Antonis, please.
Thank you, Shekhar. Just a brief welcome from me. I'm Antonis Kosoulis. I joined United for Global Mental Health very recently as Director of Partnerships. And in that capacity, I'm leading the Secretariat for the Global Mental Health Action Network. So I'm looking forward to engaging with you all. My background is in public health and mental health for many years. And yeah, really excited to be working with you all in the coming months. Yeah, over to you, Shekhar, and to enjoy the webinar.
Thank you very much, Antonis. I look forward to working with you. I would now ask the panelists to introduce themselves before I give an introduction to this webinar. So I'll begin with Brandon.
Thank you, Shekhar, and hello, everyone. My name is Brandon Gray. I'm a technical officer in the mental health unit at the World Health Organization headquarters in Geneva. I have a number of responsibilities, but one of them that's relevant for us today is leading a project we have on trying to increase integration of education on mental, neurological, and substance use care for future doctors and nurses in the pre-service education they receive. Thank you, Shekhar.
Thank you, Brandon. We go on to Salman Khan.
Hey everyone, greetings from wherever you're joining. I am Salman Khan, a medical intern based in Mumbai, India. I'm the liaison officer for public health issues at the International Federation of Medical Students Associations, also known as IFMSA.
Thank you, Salman. We go on to Dr. Sankha.
Thank you, Shekhar. Hi, everyone. I'm Sankha, a family physician from Sri Lanka, and I'm representing World Organization of Family Doctors, which is known as WONCA. And I am an active member of the Working Party on Mental Health and also the immediate past Young Doctors Lead. Thank you.
Thank you, Sankha. And we go on to our last panelist, David Stewart.
Thank you very much, Shekhar. Hello, I'm Dave Stewart from the International Council of Nurses. I'm the Deputy Chief Nurse there. We've been working with many affiliate mental health or psychiatric nursing associations around the world in the last few years. And I'm very pleased to be here and spend some time with these esteemed panelists here today. So thank you.
Thank you all panelists for joining us and also for introducing yourselves. You will all agree that mental health services are very deficient. not only in low and middle income countries, but also in high income countries. And one of the reasons for that is that there are not enough clinicians to look after the needs of the people who need services. This situation has been bad for a long time, but it is actually not improving. So the treatment gap remains very high and it is not narrowing in most of the countries. What could be the solutions for this problem? One of the solutions the WHO has talked about for a very long time is that all healthcare providers, whether they're general doctors, nurses, or other professionals, need to be able to identify and provide basic care to all people who have mental health needs. This is easier said than done, and although countries have made a lot of progress in doing that, the situation is still not satisfactory at all. How can general health workers become competent in identifying and managing mental health problems, at least managing at a basic level? Of course, one of the solutions is that you provide training to them. And again, many countries have been providing in-service training to some of these health personnel, providing training, providing supervision, providing support, and that has improved the situation to some extent. But what has been ignored is a good pre-service education, because all of these health personnel do initial education and training, whether it's as a part of their degree or a part of diploma. And this education frequently is quite inadequate in the area of mental health. And that is something which has become a very major priority now. And although a little bit late, but WHO has taken interest in this area, has started a major initiative to compile the guidance on pre-service education for doctors and nurses, which is what brings us to this webinar. And WHO's project officer for this is here, Brandon, who has just introduced himself. And I would ask him to kick off this webinar with the first question. I'll request all the panelists to answer the question in around 5 minutes and not take too much more time. So Brandon, WHO has been leading work on pre-service education on mental health. Could you give us an overview of this? What are the objectives? What progress has been made? And what's your vision for how it could assist in the major objective of providing mental health care for all? Brendan, please.
Thank you, Shekhar. Yes, I'd be happy to give an overview of our project. I want to start to just first by defining what I think is always kind of the elephant in the room when we talk about this topic, and that is, what does pre-service education mean? It's kind of an unfamiliar term for a lot of people, but in the context of our project, we're talking specifically about the preparation that future health providers receive in universities, colleges, schools. So it's the structured learning activity that occurs before they enter the profession, so before service. In a lot of countries, this is called undergraduate education, but that's not always the case. But in the context of what we're focusing on in this project at WHO, it's specifically on first degree education that a future doctor or a nurse might receive. So we're really aiming at trying to develop some guidance on what is that foundational education in providing care for people with mental, neurological, and substance use conditions that all doctors and all nurses should receive before entering service. So I think you said very well why we're focusing on this, right? We know the needs are enormous, workforce is very limited, and there's really a clear need that the field's been working on for a long time on trying to better integrate mental health care in general healthcare settings and in the responsibilities of people who are not necessarily mental health specialists, but have a very key role to play, such as in general healthcare settings. So obviously in-service training is still essential. We think it's really an important piece of the puzzle, but what's lacking is this more sustainable focus on long-term education, where you can really develop the skills in an educational setting to provide quality and effective care for mental, neurological, and substance use conditions. So that's what we want to try to change through this project in some way. So in 2022, WHO started this work to really understand what should we do and where should we go. So we started with scoping the literature, both in terms of academic literature, but also gray literature, reviewing a large number of different curricula from all across the world to understand what is happening in this area and what are the similarities, what are the differences, what are the gaps. And in this process, we also conducted almost 50 interviews with different experts who are leading some of these programs in different countries to kind of further understand what could we do as WHO to bring some of the knowledge together that is already existing and try to move this work forward. So I should say all of this background work was led by my colleague, Dr. Sherry and Kramer, who did an immense amount of work of getting us to where we are in this effort and in this project. So all of that background work in 2022 culminated in an expert consultation where we, again, we're just trying to understand what should we do as WHO, what would be the best thing we can take forward. And we learned a lot in that meeting. But I think one of the key outcomes was the recommendation that we try to develop a guide for educators, for university administrators, for people involved in this education on how they could enhance their curricula to include more effective education on how to provide care for mental, neurological, and substance use conditions for the future or for the future doctor or nurse. So that's what we've tried to do since that time. So over the last year plus, we've developed this guidance. And I think what's particularly unique about it is we tried to take a competency-based approach. So what I mean by that is we actually tried to define what are the competencies that all doctors and nurses should have once they're in service, regardless of what direction they focus on or specialize in. What's that foundational set of competencies we think they should all have when they're in service? And within those competencies, what are the attitudes, the knowledge, the skills that should be developed to lead to this competent provision of M&S care? So I think that set of 12 competencies that we have now developed in this guide are really the foundational piece that I think is quite unique and interesting. And what we've done in the guide is not only define those competencies, but then also try to provide some guidance on what the structured learning activities would look like to develop that competence. So how would you actually change a curriculum or enhance a curriculum to better develop this competence? So this is where we are now. We have a draft of this guide. We'll be ready to have it externally reviewed very soon, and we're aiming to publish it this year. But I think this is really just a first step in this area. And, you know, it's a particularly underfunded area. I think a lot of donors aren't so interested in it because the impact is long-term. It's hard to see immediately. So it's underfunded, including our work, but we want this to just be a first step. We want to actually move this forward to dissemination and testing in countries to try to truly make a difference in the education that future doctors and nurses receive. So that's our next step. We're not there yet, but we're always looking for other partners to move that forward. And that's going to be part of our focus moving forward.
Thank you, Brandon, for explaining the reasons as well as the process of doing that. As you say, it is underfunded and underappreciated, but it's still extremely important for long-term care of people with mental disorders. Salman, if I can go to you next, and also following the principle of nothing about us without us, you are the people that we're talking about, the future doctors, how they should be trained, along with, of course, other professionals like nurses. How important is mental health training in your medical education? And what role do you see for competency-based learning?
All right, thank you so much for giving me the floor. First of all, I guess all of us in the room as panelists as well as attendees do acknowledge that mental health issues are a leading cause of a disability worldwide, particularly in, let's say, the vulnerable groups, the youth and the adolescents. And in spite of how fundamental it is to include mental health to achieve health for all, there's still a lack of access to treatment, irrespective of the subjects that I may be studying in medical school because of inadequate prioritization of policy frameworks. I would say that's one of the reasons, a lack of awareness, or even us not having enough competencies to address them in a holistic way. Speaking from a personal perspective, I had psychiatry as one of the subjects in my undergraduate medical curriculum. But in my internship here, I would say I did notice alarming signs of compassion fatigue and vicarious trauma amongst my own peers, because we felt helpless about how to approach people suffering from mental health issues. Also considering the fact that mental health is largely still stigmatized in the communities. That's one. Number two, we still have a very, let's say, disproportionate number of mental health service providers, and the over increasing, ever increasing rather, burden of mental health issues. So let's imagine a world where everyone has equitable access to mental health services. And for that, we need to tackle this on a grassroots levels. And for sure, the competencies that are very important for us are the first one being human rights oriented and evidence-based mental health services. We need to be mindful of the rights infringement imposed on the individuals who are subjected to institutionalization as a result of mental illness, and to ensure humane treatment to these patients. We also need to have skills related to low threshold counseling that would sort of lessen the burden that the mental health providers or the specialized mental health providers do have. On the other side, having such competencies would help us to promote and to rather advocate for our own mental health and well-being, considering the healthcare workforce also happens to be one of the vulnerable groups in this regard. And that would help us in preventing stigma on way too many levels. Speaking of that, understanding stigma and discrimination and human rights violations against people who suffer from mental health conditions is also one of the competencies that is needed in pre-service education, in my opinion. So I did touch upon a few things related to humane treatment and to ensure a fair distribution of mental health providers, considering the current burden that we have. And that's all from my end.
Thank you very much, Salman, also for raising the issue that competency in mental health care will actually not only help the patients that you're treating, but also yourself and your colleagues, because some of the competencies that we might learn are equally important for our own mental health, which is also very important. I go on now to Sankha, who's representing Wonka here. And much of this pre-service training will actually help to make family physicians much better competent in delivering mental health care, but also delivery of integrated care. So, Sanka, what's the role of family physicians in delivery of integrated care? And if I can ask you the second question, what is the importance of addressing leadership and advocacy as a part of the training initiative? Over to you.
Thank you, Shekhar, for those two questions. I think you all know that as family physicians or general practitioners, or simply as family doctors, they are in the grassroots level, and they are in the first contact care of the patients. Now, when you take, we were talking about generalists. So family physicians or the family doctors are the generalists, or people who are having most connections with the patients. So when you take a family doctor, we all agree that in the training of the family doctor. We have psychiatry as a part of that, but still, the most important thing is we have to understand that most of the mental health illnesses could be managed at primary care level. So family doctors work in primary care level. So when you take the primary care level, it is told, according to the research, that about 1/4 of all the patients come to the primary care, come to family doctors, would have some sort of recognizable mental health illness. And sometimes 1/5 of them, like 20, say 1/10 of them, or 10% of them, would have depressive illness. And we know most of the time the symptoms are not tallying with physical illnesses. So they are called like medically unexplained symptoms. And most of the time, all the physical illnesses also are having some sort of a mental or psychological stress or psychological illness behind that. So this shows the importance of having a good training and integrating mental health care into family doctors' education and family doctors' work. That means in the primary care. So the most important thing is, even though we understand this, it's a bit challenging when you go to practice this. Integrating mental health care to primary care. So for this, practice transformation is needed. You have to transform the practices to a place which is mental health or behavioral health friendly. And also, I mean, the team should recognize and care for mental health care or mental health illnesses. So in that case, this transformation needs strong leadership, advocacy, and also change management. So that's how, I mean, we understand why the family doctors are needed to be trained in integrated mental health care into their practices. And then to change into the practices or transform the practices, we need advocacy, training, and also leadership training. Wonka has worked on this. The Wonka Working Party on Mental Health ran a very good program with young doctors a few years back, because we got down some very much motivated young doctors, and we ran a program with some sort of a practice changes implemented in their practices. We wanted to find evidence, and we are happy to say that it was very much successful, and change happened and change is happening. And some of them are now, I mean, based on the initial training, they have gone to more steps. They have improved themselves. And I mean, the integrating mental health care is not a dream. It could be done, but definitely we need some sort of a training. And probably you can see on the chat, we have provided a paper based on our experience in that program. To be honest, I myself was a scholar as well, who was as a trainee at that stage, and now we are we have gone for the next step, the second step of the same program, to find out more, I mean, more evidence to have this as a program in future, a training program which is set by the Wonka.
Thank you very much, Sanka. And it's really very nice to hear that family physicians are recognizing the need for mental health care, but also for integrated care, and are not only keen on improving the curriculum for medical training, but also taking a proactive approach to leadership and advocacy as processes which will actually improve the situation. And I very much welcome those kind of initiatives. We go on to our fourth panelist, the representative from ICN. David, what role does your organization play in integrating mental health training into nursing education? And what are some of the key recommendations from your earlier work, but also from your new mental health guide. David, over to you, please.
Yeah, thank you very much. And, what an honor to present some of our work within ICN. 2 years ago, we released a report basically looking at the mental health nursing workforce. And part of that was to understand what is the current situation. And what we found was that there are around 300,000 mental health nurses around the world, which is by far the largest provider of mental health services around the world. But there was huge disparity between countries, within regions, and particularly between income levels. There were large disparities in the workforce. And so one of the things that we tried to investigate is we have a massive shortfall, but what's the pipeline into this profession? What's the pipeline into specializing in this area, and particularly in undergraduate education? One of the things that we found, obviously, was that there was a lot of stigma, not just towards patients, but also towards the professionals themselves. And a lot of this came because there was not this exposure that we would have hoped in undergraduate education. So when we had a look and we surveyed a number of countries, what we found was quite concerning to us. We found that at least 1/3 of countries had no clinical placement hours required within a kind of mental health setting. And sometimes many of those countries didn't even have a theoretical component either. And we had more than half of the countries who responded saying that they had less than 80 hours, which is a very insignificant amount of time to actually learn. And when we did find that people were doing placements, often it was in these high acute institutional-based care. And so it gave a very distorted kind of understanding, particularly of the burden or the need growing. And so we were looking at, well, what are some of these things that can be improved, particularly around this area? And certain things came to light in that, and particularly when we looked at the education providers, often people providing the theoretical content weren't equipped with the knowledge, skills, and attributes required to also teach in this particular area. And so it's a really important strategy for us to go, wow, how do you have a pipeline of nurses wanting to move into the profession if they're not exposed to it in this undergraduate program? But also because all nurses at some part of their journey will be, managing or working with people who require treatment or care in some way or another. And we wanted to move it beyond just this biomedical understanding to one that embraces particularly a nursing philosophy of being that advocate and working with that patient-centered care, empowering them to be involved in their shared decision. So as a result of that report, we've been working now towards another one, which we'll be releasing very shortly, about guidelines for mental health nursing. And it does cover the prerequisites for, all nurses, which we see all nurses having some kind of minimal levels of education. But then as they start to progress in that more specialization, what are the competencies needed to progress, to learn and develop even more? And so we've sort of got this career trajectory that we're doing with undergraduate education, their alignment. So some of the things that in particular we're trying to do is we're trying to encourage particularly regulators to incorporate their national health priorities into their competencies within nursing education. And we want to see particular things throughout that, whether it be, identification, care, treatment, ethics, law, all those different components. We want to make sure that there's a minimum standard of competence within there. We believe it begins with educators, with our regulators, and other core components. We try and provide advice, particularly to all different levels of providers, about how they can improve the education. So thank you for just that brief overview.
Thank you very much, David. ICN is a very important stakeholder in this field, and not only the 300,000 mental health nurses, but all millions of nurses need to be much better trained in understanding the mental health needs of the population that they serve, but also become competent in providing some of the basic care along with other health professionals. So your inputs as well as the inputs of your organization are extremely valuable to make a difference in this field. And also thank you for raising the point that you would like to work with the regulators as well as educators, because without them, this kind of effort will not succeed at all. And I hope Brendan for WHO is listening to this and incorporating some of these things in the plans that WHO will make to have this guide accepted widely and with the involvement of all stakeholders. I can see that there are a lot of comments on the chat, and many of you have provided very nice commentaries, but also links and other information about the country that you know well, which is all extremely important. I am requesting Divya to keep a record of the chat so that we can actually have a look at it earlier. I can also see a number of discussion points and questions coming out from the chat as well as the question and answer section. So now we have some time to ask our panelists a little more detail and probe into the contribution that they and their organizations can do to make this initiative a successful one. So I'll begin with my first question, which is actually directed to any of the panelists, whoever wants to answer. We know that changing curricula is never easy. It has a lot of barriers, it has a lot of problems that you have to solve. Name one barrier to implementing this training, and what solution would you suggest to overcome this barrier? I know, David, you have already talked about the regulators and the educators, so we take that for granted. But let's talk about any other barriers which might arise and how would you solve that? So any of the panelists could answer.
If I may go ahead and start, I believe one of the barriers that we would be facing would be bureaucracy and policy making when it comes to integrating pre-service education into mainstream curriculum. And to, let's say, address it from one perspective, I can maybe share an example from our organization. We did realize that addressing mental health from a public health lens would require meticulous attention, awareness, and action. So we decided to take matters in our own hands, and we developed a workshop called Mental Health Essentials for Future Healthcare Professionals. The competencies that we addressed through the peer-to-peer education workshop were basics of mental health, including mental health issues, suicide and self-harm, addiction, the social factors and stigma, including social determinants of health, stigma surrounding mental health, the impact of social media, including the negative impacts, as well as the impact social media can have in combating stigma, and hands-on techniques, including psychological first aid, stress management, communication and expressing feelings for mental health, as well as practical applications, including managing your advocacy actions on ground to combat stigma, as well as leadership in addressing mental health. The modules are, as I said, peer-to-peer based modules, and they are made on the basis of adult learning theory and different methodologies, including reflections, including presentations, storytelling, hands-on techniques, and practical applications, including activity management. We've been conducting this workshop since 2019, And apart from that, we also have a system in our organization called IFMSA programs. And one such program is specifically dedicated to mental health, wherein we support our members on a local and national level to curate more activities related to integration of mental health in medical curricula and addressing stigma surrounding mental health amongst healthcare students. So at times, we need to take matters in our own hands to address some barriers. This was one example.
Thank you, Salman. Very inspirational. Taking things in our own hands is actually just the right strategy. And if medical students and nursing students demand a better curriculum, they will get it. So very, very important. Sankha, do you have anything to add there? Can general practitioners be a barrier also besides the facilitator?
Okay. I think one of the things, like for an example, when you take the general practice training curriculum, I think one of the barriers would be understanding about what should be trained. For an example, we have a curriculum in training general practitioners. And okay, yes, psychiatry is one of the subjects. But what I understand is now, as a general practitioner who has practiced for a few years, it's not just about subject matter. It's not only subject matter, it is also about soft skills. That's why I told you that leadership and advocacy, this and managing your team, improving quality, these things are important. So it's not just building or sort of teaching subject matter, but it's also about capacity building, how to practice in a way, how to change your practice. So I think in developing curricula, I think it's very important to include these things also, not just subject matter, because subject matter could be learned by anyone, but these things could be learned, but these things should be guided and taught, or say should be, sometimes it's more than teaching. It's like you practice and you learn yourself.
Thank you very much, Sankha. I hope that Brandon is listening about some of these barriers and how those can be taken care of. Brandon, do you have anything to add there? I'm sure WHO must have thought about what kind of strategies you will put in place to actually not only produce the guide, but to make it successfully implemented in all countries and regions of the world. And if I can just ask you a supplementary question, is the guide, which is going to come before the end of the year, is it meant only for some regions or only for low and middle income countries, or does it have a global scope?
Thank you, Shekhar. So first I'll start with the question about barrier. I think it's a really interesting one. I really like Salman's example because it's an example of the students taking it on themselves, and that's really impressive example to hear. I think there's also an effort of the system to take it on and change the issue. And I think one of the biggest barriers is that it in some countries, in many countries, it takes so long to change curricula. Sometimes curricula are set at a central level in some countries, and so it can take years to revise the curricula. But I guess the positive side of that is once you've done it once, you don't need to do it again in that country. So I think that's the barrier, is that it is a very long process. And so with that comes the issue of impact not being seen immediately. And so it's hard to dedicate funding for some people to this topic because it's hard to see an impact right away. You don't really see the outcomes for many years. But I think that there's a strong case to say that once you do see the impact, it'll be sustainable in a much stronger way than other efforts we might see more immediate impact. So one of the solutions, I think, that we're trying to take with developing this guide is actually telling the stories of how these things have made an impact in other countries where there has been some of this pre-service education already ongoing. And I think we need more of that, more of these discussions like today, telling the story of why this is important and actually showing how it can be impactful, but also some more research, particularly on if cost effectiveness, impact in reducing treatment coverage, coverage gaps, things like that that I think we don't have, but we need to continue to work on. So those are some of the solutions I think that can be quite useful, and some of what we hope to do with this guide and having stories about the impact that such education can have. So in asking if it's relevant for only some countries or globally, I hope it's relevant globally. That's our aim. Our idea in this guidance is to provide a few examples of ways you can start this depending on where one's at. So it really focuses on beginning with the situation analysis, and there are some nuances in the guide on how you can approach enhancing your curriculum based on the amount of resources you have. So it can be something that's simpler in settings where resources are quite constrained, and it can be something that's much more comprehensive where there are a lot of resources and political will. So our hope is that we're relevant globally, and we try to have case studies from all around the world as well, and some of these nuances in how to approach things based on the resources you're coming with and where you're starting at. Because I think, you know, we've discussed where universities begin is maybe the biggest difference across the world. Some are starting truly at the beginning, some are somewhere in the middle of this process, some have been doing it for a long time. So we have to kind of consider those things in developing this guidance.
Thank you, Brandon. Another question which has come out from the chat is that other stakeholders also need to be involved. We have a number of stakeholders represented in this webinar, but are you also considering people with lived experience as an important group of stakeholders? And do you have any plans or already are involving them in preparing the guide, but also its in dissemination and effective use?
Thanks, Shiger. Yes, this is an essential question. I think when we talk about this topic, there's two types of lived experience you could refer to, right? There's people with lived experience of living with a mental health condition, and there's also people with lived experience of students having gone through pre-service education, like Salman here. So I think we're trying to engage at both levels, or at both types of experiences. So in our guide, particularly, I mentioned earlier, we have these 12 core competencies that we think all doctors and nurses should have in pre-service education. And we've been consulting with students on what those should be, but also with people with lived experience to make sure that they are commensurate with what they would like to see in the services they receive. So there's the Global Mental Health Peer Network that we've been engaging with quite strongly around this topic, and receiving review and consultation on what those competencies should be, and we'll continue to do that. Part of our guide also focuses on who should be the steering committee in any setting where you're trying to enhance a curricula or revise a curricula to include some of this content. And one of the key stakeholders we mentioned there is both students and people with lived experience. And we have some guidance there on how to go about forming that committee, ensuring those stakeholders are involved. So I think it's a critical piece we definitely can't miss, and we're aiming to not miss in our process as well.
Thank you, Brendan. And I must also mention that Farzana Sharmeen from BRAC in Bangladesh was expected to join, and we are putting some of the information about her work in the chat so that you can at least access that. I go on to David now to ask him any comments on the issues that we're now discussing, including the issue of barriers and anything else that ICN would be able to do to make this initiative a success that WHO hopes it will be. David, please.
Yeah, thank you. And I just want to build on some of that previous conversation, particularly about the power of students, and that COVID has been an interesting issue in that it's brought to light some of, or exposed more of, the challenges around mental health. And a lot more research has been undertaken, particularly around the mental health of nurses themselves and the strategies that are being undertaken. And we know from some of the research in Canada and from Carlton, Nicholas Carlton, I think his name is, and Lenetsky, that mental health of nurses is 4 times worse than that of the general public. And students are starting to understand this and sort of say, well, we need to start looking at self-care. We need to look at, not just patients, but also within that. And so there's that demand for the curriculum change to have a look at, how we deal with our own kind of issues, but also in the broader it's brought it to light a bit better. And I think that's a really positive step. And it's coming because people are seeing the research. Students are starting to challenge, hey, we need to deal with this better. And I think that's a really good point. But for me, I think the biggest barrier is it's all interconnected. But the challenge that I would see and that we'd try and work with immediately is this need to invest, particularly in the education providers themselves. It's very difficult to have our professors or our teachers who have very limited experience or exposure, or if they do, it's in a very high and an acute setting. We need to have investment on people who have a career pathway in mental health nursing, have a pathway that also then moves into becoming an education provider. So having investment in university programs that have people who have the right qualifications to actually teach, particularly mental health, and import it into the curriculum in an appropriate way. And so for me, I think one of the things that we're calling for, particularly at ICN, is invest in those nurse educators, create those pathways so that people are able to move in them and become teachers themselves and pass on to that next generation, because that's probably our best bang for buck comes from those who are highly qualified to actually pass that knowledge and competency on as well. And that's where we would like to see a lot of more investment going.
Thank you very much, David. A very important point that unless we have competent educators, we cannot have competent trainees. And that area again requires a lot of effort, because I'm aware also from my own experience that to move from clinical psychiatry to teaching mental health is sometimes a big move. Psychiatry as a medical specialty versus mental health as a much more comprehensive concept of what mental health problems, including disorders, would be like and how to take care of that. In fact, as one of you mentioned earlier, quite a few of the training programs are actually based in institutional settings with very chronic patients who are actually not the ones that go to general practitioners after the graduation. So to align the kind of practice that a graduate will get into to the education that the person receives is again a big step, and that could be a major barrier because educators are focusing on things that they see as a specialists versus the other things that the students will see as they graduate as non-specialists, and that is again one of the things that requires a lot of attention. We now go on to discussing any other aspect that any of you will feel important. One question that has come out from the chat, and I will particularly direct it to Brandon, is what about professionals other than doctors and nurses? Because obviously, healthcare providers vary a lot across the disciplines. What about counselors, psychologists, or social workers, or other professionals who also get in touch with patients who require mental health care? Is there any thought about that?
Thanks, Shaker. Thanks for this question. I think it's one of the questions we've grappled with and trying to understand the direction that we should go with this project. Ultimately, we thought through consultation process and then from recommendations from different experts that a starting point, a good starting point, is to work with future nurses and doctors, particularly because these are the points in the healthcare system where most people with a mental health condition, neurological condition, substance use condition, the first point where they most often interact with the health system. We think it doesn't mean that counselors, psychologists, social workers, psychiatrists aren't necessary. They're essential parts of the mental health workforce. But what we're thinking with this project is to have the widest reach by working with the most common providers. David just gave us figures that show, mental health workforce is primarily nurses in many countries. Doctors have a huge role to play. So we want to focus on this education to begin with. Not to say that that the education of those other types of the workforce isn't important or shouldn't be a part of the focus in the future. But this is perhaps our starting point, I would say.
Shekhar, if I add to
Yep.
that, because as general practitioners, we have also identified the importance of other professionals because it's a team always. It's not only just a doctor. Probably the family physician would be the team leader in primary care, but of course, when we are talking about integrating mental health care, it's essential to have nurses, psychologists, and other healthcare workers informed, and they are sensitized about the mental health problems, and they should be sort of probably guiding even patients to doctors. That sort of environment should be created. So I think it's very important to allow everyone to lead as a team at healthcare professionals.
Thank you very much, Brandon, and also Sankha. My last question is again to everybody, but I'll begin with Brandon. What are some of the foundational skills that the guide should talk about, and to what extent they will be useful for care of people with mental health needs versus the care of all the people that some of these doctors and nurses will face?
Also, a very, very good question. I think what we've tried to come up with in our guide ranges from promoting mental health and well-being, just in any interaction in a healthcare setting, all the way to diagnosis, management, and follow-up with a person who is living with a mental, neurological, or substance use condition. So I think it needs to be competencies across that spectrum of care. And what we've come up with are 12 competencies that I think range in that way, from foundational support, like active listening, like maintaining confidentiality, that basic psychosocial skills that we think any provider should have, to rights-based care related to what Salman was saying earlier, ensuring that we're focusing on quality human rights within mental health care. And then also to nuances like assessment for mental, neurological, and substance use conditions, management, including psychotropic management, but also psychosocial support, follow-up, referral to the right providers where it's necessary, and then also self-care. We think this is a key competency as well. So those are some of the things we have right now in our set of 12 competencies. We hope we've covered most things, but again, we're going to be doing a review soon, and so we may learn that there are other competencies we've missed.
Thank you, Brandon. I would also like to remind all the listeners that there are many links which are in the chat, and one of the links is to WHO quality rights training, and some of our panelists have already raised the question of rights-based care, which needs to be part of what we teach to doctors and nurses about how to protect and honor the rights of the people who come. Rights of not only people with mental health problems, but also rights of all patients, actually. And that is something which is quite important. We come to the last section of this webinar, but before I go on to asking you for a very short question on a tweet length statement, let me just pass it over to any one of you who would like to make a point very briefly in a minute, which might not have been covered but is important. So anybody.
If I may add here, it's also very essential for us as in healthcare workforce and even the future healthcare workforce to be capacitated enough to contextualize the burden on ground. Not everything that we, let's say, formulate through discussions is going to be applicable in every part of the world to an equal degree. Let's say a healthcare professional or a healthcare student in country X might face some more issues related to, let's say, shortage of health workforce. A country Y may face more issues related to, let's say, stigma. So it's very important for the workforce to be able to contextualize the issues and then provide contextualized healthcare as well.
Thank you so much, Salman. That is extremely important point, that the guidelines can be global, but its implementation needs to be national and local. depending on the context, depending on the healthcare system, depending on the community's needs, and all of that. So again, Brandon, I hope you're noting that, because it's important to make a global guide, but it's also important to put in some processes that needs to contextualize it to the local need. Thank you again, Salman, for making the point, and thank you all the panelists for raising some very, very important questions. My last question is a very short one. Complete the following sentence into a tweet length statement. To effectively integrate mental health training in the education of doctors and nurses, we must. And I begin with Sankha.
Okay, I would say to effectively integrate mental health training in the education of doctors and nurses, we must focus on training, leadership skills, and advocacy.
Thank you, Sankha. We go on to David.
Thanks. I think for myself, mental health must be seen as a national health priority, and then the competencies must align to that. Too often we see that, it's not a priority, therefore it's not reflected in the competencies. So it must be seen as a national priority, and then the competencies should align to those.
Thank you, David. Salman?
So I might start with reading the tweet that was read by you again to make it make sense. To effectively integrate mental health training in the education of doctors and nurses, we must meaningfully engage young health professionals and students in, number one, developing relevant competencies and curricula to ensure human rights-oriented treatment, and number two, advocating for addressing stigma on all levels.
Thank you, Salman. And lastly, we come to Brandon.
Thanks, Shaker. I've actually never sent a tweet, but I think this fits, so I'll try it. I'd say we must take a long-term view to find sustainable solutions, understanding the impact will not be immediate, but it can be immense.
Thank you. Those are good tweets, and I hope Divya is noting them down and will put it out as tweets. Lastly, my own take on this: to effectively integrate mental health training in the education of doctors and nurses, we must align the education with the needs of the community and the aspirations of the people with lived experience. That brings me to almost the close of this webinar, and I want to thank all the panelists for actively engaging, presenting some material from what they and their organizations have been doing, but also raising questions which are well covered in the chat, but also in the discussion section. So I think we have had a very engaging discussion, but also thanking the participants for not only joining in, but also contributing by their thoughts, by their links, and asking some very, very important questions. The webinar is coming to an end, but the discussion must go on. So I hope there will be further discussions as a part of the Action Network, but also as a part of the further activities of your organizations. And I'm also hoping that the WHO will bring out the guide much earlier than the end of the year, hopefully, and will take the help of our panelists here in their organizations in making it a very big success. The discussion will also continue on Circle, and I am hoping that they will put in the link to that, where all of us can continue to join and discuss this very important topic. I should also say that these webinars are now being joined by a number of people. They have become a great success. There will be no webinar in the month of February, but look out for the notice for further webinars in March. And we'll continue on topics that are equally important to this. In the end, I want to thank, of course, everybody, but also the team at United, especially Divya, for organizing it and arranging all the practical details in such a nice manner. Thank you again, everybody, for joining, and have a nice day further on. Bye-bye.
Thank you.
Thank you.